According to the Center for Disease Control, 1 out of 3 adults aged 65 and older falls each year. Over 95% of hip fractures are caused by falls, and falls are the most common cause of traumatic brain injury. Knowing whether or not you or a loved one is at risk for falls, and then addressing those specific motor or vestibular impairments is of utmost concern in the aging population. Here at Summit Physical Therapy, one tool that we use to accomplish this task is the Neurocom Balance Master. This interactive rehabilitative device provides an objective assessment of the voluntary motor control systems that govern our balance. Through an 18 by 60 inch dual force plate augmented by a visual biofeedback system, the Balance Master is able to both assess and aid in the rehabilitation of an individual with balance deficits. This program starts with a single or series of tests that can objectify one's gait, sit-to-stand ability, and weight shifting capability during specific tasks. This information is quantified through force plate measurements and then diagrammed graphically and numerically against normal values for the patient's age-matched group, so the patient and therapist can see what areas are deficient. Once the areas in need of retraining are identified, the rehabilitation can begin. The Balance Master's visual feedback system gives the patient a real-time representation of their movement patterns. Training protocols are already programmed into the system, and the level of difficulty can be modified to address those with severe impairments to those whose deficits are less apparent. Even those patients who may not require a rehabilitative program can have their balance assessed and interpreted by a licensed doctor of physical therapy, who can inform the patient and family members whether an assistive device such as a cane or walker may be needed, and whether or not someone may be at risk for falls.